Good evening. It's the end of the week and you're watching The Big Story, where we'll discuss the hottest topics of the day. I'm Dylan Ang, coming to you live from the Straits Times newsroom. It's February 14, Valentine's Day, and in that spirit, Prime Minister Lee Hsien Loong handwrote a note thanking doctors, nurses and healthcare workers. Shared on his social media platforms, PM Lee's note said, quote, "Your loving care and commitment makes all the difference." The post was tagged Braveheart SG, an ongoing movement inviting people to handwrite notes of encouragement to frontline medical staff and share pictures of them on social media with the hashtag. Now, earlier today, Prime Minister Lee warned that a recession may be headed our way.
Well, I think the impact will be significant, at least in the next couple of quarters. It's a very intense outbreak. I think it's already much more than SARS. And economies of the region are much more interlinked together. China particularly is a much bigger factor in the region. And therefore, I can't say whether we'll have a recession or not. It's possible, but definitely our economy will take a hit.
Now, Prime Minister Lee was speaking to reporters at Changi Airport, where he touched down there to show his appreciation to frontline workers. Here's multimedia journalist Kimberly Zhao with more.
We're currently at Changi Airport, where Prime Minister Lee Hsien Loong dropped by to check in on our airport frontline workers. Amid the coronavirus outbreak, where there seems to be a cloud hanging over people's heads, there's nothing more reassuring than a visit from the Prime Minister himself. China travellers account for 11% of Changi Airport's traffic and 1/3 of retail sales. Now, traffic between China and Singapore has come down significantly, with flights shrinking 70 to 80% and traffic volume down by 60 to 70%.
Today I came to visit Changi Airport because Changi is on the front line as the travel industry has been substantially impacted. The flights are down by 1/3 and the shops here are hard hit. And at the same time, the crews have to keep the airport running and stay at their posts and keep Singapore open for business.
Spending about 1.5 hours here, PM Lee spoke to a wide range of workers, ranging from those handling baggage to cab drivers.
So I had a chance to talk to the baggage handlers, I had a chance to talk to the taxi drivers, talk to the ICA staff, all the different functions in the airport, the people answering, giving public information, the people who are manning the shops, the cleaners, the medical team at the airport, to make sure that they are all right and to let them know that we are standing with them. And I'm glad to know that they are in good spirits. We are keeping them informed, and where they have issues, we are dealing with those issues and making sure that the people are confident that they can do their job. That's the main purpose.
Now, it's not just a visit and encouraging words from the PM. Changi Airport Group has also introduced measures such as long-lasting disinfectant, 1,000 more hand sanitizers, and enforcing temperature checks for passengers in a bid to protect the health of airport workers, passengers, as well as visitors. Kimberly Zhao for the Straits Times.
Now, do look out for Sunday's special edition of Insight called On the Frontline, where ST speaks to people on the front line of battling the coronavirus. The special will feature people like healthcare workers, including doctors and nurses, as well as whole-of-government efforts like the contact tracing teams, which were activated to stem the spread of the virus. The first episode of the video series, titled On the Frontline, features a general practitioner, a contact tracer, and a nurse working at the National Centre for Infectious Diseases. The video will be released this Sunday. Here's a brief look.
My parents do have some concerns on me because, being a nurse and I'm in NCID, they probably a bit more worried about me. But, I always reassured them that, I'm safe because, we attended so many trainings, our infrastructure is so well engineered for protection. So, yeah, so after reassurance, then they are much better. But they still support me, working in an NCID.
Now, the Sunday special will also explore how this outbreak is playing out across Asia and the world, and how scientists globally and in Singapore are racing to find a vaccine. Look out for the spread in the Sunday papers and online at straitstimes.com, where we bring you the latest in our coverage of the coronavirus. Now, moving on, it's been a week since the Ministry of Health announced the raising of the DORSCON level to orange. As of today, there are 58 confirmed cases of the coronavirus here, with 8 new cases announced yesterday. 5 of the 8 new cases are linked to the Grace Assembly of God Church, including a 54-year-old man who is a professor from the National University of Singapore School of Design and Environment. The Ministry of Health said yesterday that the professor did not interact with colleagues and students after he fell ill. The church, which has locations in Tanglin and Bukit Batok, is now linked to 7 confirmed cases, including the church's senior pastor Wilson Teo. 2 earlier cases, both staff members at the church, were announced on Wednesday. There are now around 64,000 confirmed cases in China and over 100 new deaths. The country's death toll rose to 1,380 today, but the number of new infections in hard-hit Hubei province fell after a change in case definitions caused a massive increase the previous day. Japan has also reported its first death, a woman in her 80s in Kanagawa Prefecture. Now back home, there's ongoing talk about issues surrounding the coronavirus and its spread. For some clarity and insight, I'm joined by Infectious Diseases Physician Dr Leong Hoe Nam from the Rofi Clinic at Mount Elizabeth Hospital, Novena. Welcome, Dr Leong. Now, Dr Leong, you have first-hand experience in managing outbreak situations, including SARS and H1N1. Now, what do you think of Singapore's approach in combating the coronavirus?
I think Singapore's approach, the government's approach, has been top-notch. And I say it not just because I'm a Singaporean, but as an infectious diseases physician, I see all the steps and the check boxes all ticked. And not only has Singapore received accolades from amongst ID physicians, but we see it happening from overseas. And there's a lot of comparison between the Singapore government and the rest of other governments in the area, in the region or elsewhere that's stricken with the same disease. And the same consistent story happens. Singapore's doing everything right.
Now, Dr. Leong, it all sounds good and dandy. Now, what else do you think can be done better, though? Because surely there's room for some improvement.
I think the government has done a lot of things. Agree there could be even more preparation, but this sort of outbreak and this sort of fear that comes out, this irrational fear sometimes, have become, it's hard to predict, okay? But that's life. Nothing is totally predictable. But rather, I feel that there's something we can do, and that is actually down to the people. Right down to the people. The people can actually cooperate with the government better. I think one simple example is, if you're sick, please don't go into work. You are shunned from work. Don't go into work, and if you really have to go out, put on a surgical mask and go out. If you have a medical leave, respect that medical leave and stay at home. So you must understand that the coronavirus outbreak we have is a common cold virus. So it behaves like any other common cold. If I were to see a doctor, the doctor will have no idea if it's the real coronavirus or another common cold, and it's really difficult. And the best thing you and I can do if we are sick is to stay at home so that we do not spread the virus out. If you are sick and you travel out and you go off to work to do that work, you may have inconvenienced your entire floor of staff, your entire, all your colleagues at work, and you could just shun them all into quarantine. So on my part, Singaporeans, please do your part. If you're sick, you're not feeling well, you have medical leave, please don't go into work. You might just end up killing your colleagues.
Wow. Now, Dr. Leong, let's get into it. China, of course, they recently reviewed its method of diagnosis. Should we follow, China's footsteps on this?
No, we shouldn't do what the Chinese are doing, simply because it's about, they have a high pretest probability. If a person with a fever and a cough comes into the clinic, there's a high likelihood that a person has this unusual novel coronavirus, or COVID-2019 as they call it. Now, the other way of calling it a high pretest probability is a high prevalence of disease. So if I were to throw a stone anywhere, chances of me picking up will be extremely high. Right. But the contrast in Singapore is that it's really hard to find one such case now. Out of 6 million people, we have about 58 cases now. The chance of striking lottery at first prize will be much higher than actually finding coronavirus in Singapore. If we use the reverse and what we do in China for Singapore, then we'll end up with a lot of false negative, unnecessary a lot of false negative, unnecessary diagnosis, and we are missing good diagnosis like influenza, common cold in these people.
Right.
So no, that's not for us, at least not at this point in time. Perhaps if it becomes very prevalent, and God forbid, like what's happening in Wuhan, China, yes, we will have to go that way.
Right. Now, Dr. Leong, let's zoom in on one of on a much talked about issue. Now, a lot of people are asking, should I wear a mask or not to wear one? What is your take on this?
I think we look into when we should wear a mask. It's much easier. Number one, if I'm sick, I should wear a mask because I don't want to spread anything to you. Now, that is first and foremost, you must do that. Now, for those people who are more than 65 and who are a bit on the heavyweight side, what I call the BMIs that are more than 30, you are at risk of getting a more severe form of the disease. Yes, in those people, I would encourage you to wear a mask, or better still, don't go out. Don't go out, stay at home, and the risk of you getting infected is extremely remote. Now, if you happen to have extra masks, okay, and you intend to use it, you must be cognizant of the fact that you use a mask now, you might deprive yourself or a colleague or friend or family member of a mask later. Let's be realistic here. Every country is stopping the export of masks. Not just the export of masks, but the materials that make the mask, which means the last mask which Singapore has in its stores might be the last. I know for the fact that the government is actively trying to procure and secure masks.
Right.
But we have to think that all our masks, all our ammunition, all our shields and all our defenses is exactly what we have up to now. And we have to defend the weak, and we have to defend the healthcare workers to deliver care. If you were to use a mask now indiscriminately, you may lose a mask. Yes, I can't stop you. If you feel threatened and you want to wear a mask, go ahead, wear it. Number two, but please conserve it. Don't use multiple layers. Use it correctly, use it responsibly, and if you can, even reuse it. Now, the third thing is this. You must be cognizant. You use a mask now, you may be short of a mask later. If you feel you have a lot of masks, please go forward and donate your masks to your neighbors and friends. Even I've seen a message out from the traditional Chinese medicine group. They have masks for up to 2 weeks. They are healthcare workers too. They need masks. If you have extra masks, my friend, bring it out and share with them.
Now, doctor, there's also this idea of clinic hopping, people consulting more than one doctor. Why do people visit different clinics, and what would you advise them?
The idea of clinic hopping, you get a different doctor, you get a different opinion, and sometimes you might get a smarter doctor, and you might get a better diagnosis. It doesn't play well now, especially if your presentation is that of fever, cough, or what we call the COVID-2019 signs and symptoms. If you have that, you should go back to the same doctor, let the person know that you're not getting better, and the person can escalate. I can tell you, a lot of doctors now on the ground actually have access to other senior doctors, infectious diseases physicians, where they can discuss the case actively and work out something suitable. Now, if you doctor hop, you will bring your virus hopping along as well. To the next clinic, whatever you have, if it's a terrible COVID-2019, you would have affected 2 clinics, not just one. If you hop to 5 clinics, you might have just become the super spreader of tomorrow. So my best suggestion to you is stick with one doctor, go with the doctor, and if something is not right, ask, do you think I should refer into the hospital and get a second opinion?
Right.
Okay? Doctor hopping, this is the no word of the season.
Right. Well, now, doctor, let's, on a final note, let's just end off with final question. We've seen 2 extremes, really, in terms of the interaction with our frontline workers, namely those in the healthcare sector. Companies like Grab, for example, have launched the Grab Care service, while on the other end of the spectrum, there's stories have emerged on social media of these workers being ostracized. Now, what are your thoughts on this issue?
I I'm disappointed that such things have happened to my colleagues. It shouldn't happen like this. Healthcare workers are here to serve you. They are not to actually cause any problems. And you might identify them because they're wearing the hospital clothes, or you can see the hospital clothes through the bags. My friend, when these people attend to the sick ones, they'll be properly gowned up, they'll be properly suited, and what they wear out on the trains, on the bus, no, it's clean. There's no virus at all. There's no risk of the virus passing on to you. Now, what I would really appreciate is that you approach a person, you don't even need to shake their hands. Don't shake their hands. Just acknowledge a nod, thank you, and that's fine. If you are fearful, what you can do is just say acknowledge and move away. That's fine. But there's no need to ostracize, there's no need to condemn, and there's no need to push the person off the bus. That is uncalled for, unwarranted. We should instead show love. And we don't need to shake hands, just a nod, a smile. And that will make the nurses their great day, the doctors simply delight.
Well, thank you so much, Dr. Leong. I think it's true. We really need more love in the world.
Yes.
Now, well, that was, of course, Infectious Diseases Physician Dr. Leong Hoe Nam offering his take on some of the issues surrounding the coronavirus here. And you can keep up with the latest on straitstimes.com. And those were our top stories for today. Keep up to date with news in Singapore and around the world at straitstimes.com. I'm Dylan Ang. See you next Monday for more stories on A Big Story. Have a great weekend.